In this video, we're going to be reviewing the second part to stretching your baby's neck to treat torticollis. Welcome back to Tummy Time Academy. I'm Dr. Tim, pediatric physical therapist. But before we get into the stretches for your baby, for those parents who suspect that their baby may have torticollis because their head is tilted one way, rotated the opposite direction, perhaps during pictures, or maybe a family member has noticed it, but you haven't discussed this with your pediatrician yet, then I urge you get on the phone, make that appointment with your pediatrician, because the longer you wait, the worse the outcomes can become. Check out my video linked above. In that video, I break down how to gauge the severity of torticollis and then also provided you those outcome statistics as it relates to delaying treatment. All right, so back to stretching. Stretching can be very intimidating. Now, I want to break down some key principles about stretching, so hopefully it brings you a little bit more comfort. First of all, stretching should not be painful whatsoever. You do not want to force a movement, and if you feel like your baby is trying to force the other direction and it's becoming really difficult to stretch, then just let them win. Back off. You don't want to injure them. Instead, what we're trying to achieve here is a light pressure. What I like to describe to my families is something like a penny weight pressure, or the amount of force you're using is the weight of a penny. And depending on their age, the following techniques you may find will work better for some kiddos, and then some kiddos may find another technique better. So change it up, try it out depending on your child. Now, the first one is a one-person technique. The one-person technique is useful for when a baby is still small and is not moving around a whole lot. Say maybe they're like before 3 months old or something like that. Now, the baby's going to be lying face up in our lap. We're going to use one hand to stabilize their trunk, and the other hand is going to support underneath their head. Now we're going to use that hand underneath their head, and we're just going to side tilt them away from the tightness and then rotate their head in the opposite direction. And if you have any space, then you can allow their head to lie back. The hand that's on their trunk is going to try to stop their chest from rotating, as if their range is limited in their neck, then baby will rotate their chest to compensate for that. The next technique is a two-person technique. I find the two-person technique to be useful for when baby's moving around a bit more and needs a little bit more help stabilization. So this is usually after 3-4 months where you just need more help. So what we're going to do here is baby's going to be lying face up. One person is going to be stabilizing their trunk, again, to try to reduce that compensatory motion if their range is limited by rotating. The other person is going to be supporting their baby's head. Just like before, they're going to side tilt their head away from the tightness, rotate their head in the opposite direction, and then if you have room, allow their head to lie back a bit. And if you find these stretches a little intimidating, then these next couple are a bit more parent-friendly. So this is called a side lying hold. And what I'm doing here is baby's resting their head on my arm in a way that, again, side tilts their head away from the tightness. Let's say, for example, if baby tends to keep their head tilted towards the right, then I would want to lay them on my right arm with their head facing out. That way, their head is tilted towards the left and providing a stretch to the muscle in question, sternocleidoid mastoid. And while the side hold works on that flexibility for the side tilting, I'm going to give you another stretch here that I find really effective to work on that rotation. So this one here is especially useful for babies before 3 months old, because they don't have they're still working on the arm strength, so try to push away from mom or dad. So what we're going to do here is when baby's lying on your chest, we're going to turn their head in the opposite direction that they typically turn their head. Now this is nice, I find, during contact naps on the couch, or maybe even when they're sitting in a baby carrier facing you. All right, so you know how to do the stretches now. How frequently should we do it to address this torticollis? And I'm going to use a study for an example. And the study took newborns that were less than 3 years old, and they all had range of motion limitations. the babies were separated into two groups. One group was told to do 10 sessions of 10 stretches per day. That equals to like 100 stretches. And the other group was told to do 5 sessions of 10 stretches per day, or let's just say 50 stretches a day. And what they found at the end was that both groups had significant improvements. So hit that subscribe button if you want to stay tuned to part 3, where we're going to go through some active stretches during play for your baby to address their torticollis. In the meantime, if you missed part 1 of this torticollis series, you can catch that right up here. And if you and your child are having difficulty with tummy time, then check out the video right below. Otherwise, I hope you guys enjoyed my video. Don't forget, hit that like, hit that subscribe button, and I'll see you guys next week.